Good afternoon. Now, let me talk you through the major incident cupboard. So, before we do that, I want to show you the tags. Probably we would have discussed this on an earlier Zoom meeting, but these are the tags that we put on patients. So, if the triage nurse classify them as immediate, you put that on and it's all inside this plastic bag. You and there are 4 choices of triage there. There's the delayed, there's the dead, and the urgent. Okay, and it will be down to the triage nurse to put these tags on the patient and put them on a plastic bag and attach them to the patient when they come in the department. Okay, so let's go in. Okay, now this is the major incident cupboard where we keep all the stocks ready for when we do have a major incident in the department. So here, let me show you the board that Dr. Stephen Bland has designed for us and paid for himself. So this is the state board that we will be positioning right outside the Star Suite. And this is where we could monitor the patient. So resus is there for priority 1 patients. Now you will see they are color coded. Priority 1, priority 2 will be yellow, red, either red or yellow there for pit stop, and so is a majors 2. Observation ward is where we would normally put patients who are dying or who are classified as dead. This is where these tags corresponds to this. So, if a P1 patient has been triaged and we have to put in resus, we have to put the major incident number of this patient, the sex, the age, what the problem is, and the time they came in. And now we will have to put this tag where the patient has been moved to. Either they go to pit stop or they went to resus. So let's just say patient priority 1, first patient went to resus. Second patient, who's also a priority 1, will have to go to pit stop 1. And the patient whose priority 2 came in would have gone to majors 2. And it's gonna be the doctor who is in charge and the triage nurse who's gonna decide where these patients are going to. So if we put them there, you can see all the patients who are in the department, and if you look back at this, you can see how many red patients are in the department. There are 2, and there's 1 priority immediate patient. So for majors 1, we only have priority 2, which is, majors 1, this is where we put the priority 2 patients. So even if you put a priority 2 there in majors 2 and 2 in majors 1, you can see that we have 3 in the department. And with each sticker here, it corresponds with, let me just show you, we also have to fill in the paperwork for everyone who presents in the department. So every patient will have their own folder. So this will all be numbered, major incident 001, 002. That is what you put on this blank page here. So we can identify and we don't lose any patient in the department. Just imagine when there's a major incident, there will be a lot of patients who's going to be presenting, and we have to monitor them because they're not going on Oceano. We will have to fill in this paperwork. So every folder, every sleeve will have everything in it. This form, the major incident registration form, and we have to fill in. Probably we can start this off and the doctor can fill in the rest. All the blood request forms are there, and there's also an ICM form attached to that. Okay, now, so we flip the board over. So for priority 3 patients, we also have green stickers that you can put where priority patients are supposed to go. So this board, this side of the board, we only put priority 1, priority 2. Minus is where we put the green ones. But you can see these are very limited. We can only put about 6 patients in there. Hopefully, we can triage them out. If they're all walk-ins, they're priority 3s, they're walk-ins, we can send them somewhere else. But if they have immediate, it's like a broken bone that needs to be fixed, either we move them to fracture clinic or there will be ENPs in the department that can attend to them. But they're all going to be very limited. So green goes in there. And the minors area where ambulatory, what it is now. So if you flip this over, these are all the stickers for the priority 3 patients. And same with the other side, every time you pull one sticker off, it will count the number of priority 3 patients in the department. This will just give you a guide of what we're dealing with and a guide of how to triage them. If they're walking, yes, they're priority 3 and it can be delayed. If there's no signs of breathing, you will be given a copy of how to triage a patient. So if there's signs of life, no, after stimuli and error maneuver, they're dead. But if yes, catastrophic hemorrhage, they become priority 1. So this is just how we would triage a patient normally during a major incident. With this decontamination team, when we have to open the tent for the major incident, we have to keep tabs of who goes in the tent, because you can only wear the suit for about maximum of an hour. So we need to put the names of everyone who's suited up and where are they in the grand scheme of things. Are they inside the tent, standing on the red zone or the green zone? So name where they are, what time did they don the suit, what time did they go in the suit, and the time they're supposed to be out of that suit. So any further comments, if they had to disrobe before that, put it in there, and they've moved out. And we erase that patient, that staff's name once they're off the triage and the decontamination team. So technically, we need to have at least 12 staff, support workers or nurses, each shift trained to do the suit, to go inside the suit, and how to set up the tent. Every shift, we need at least 12 trained members of staff to fit into these roles. So that's what we're doing right now, trying to train everyone in the department to be prepared for this eventuality. Now, these are the trolleys for every areas of the department. For the priority 1, priority 2, 3, and 4, we have this that you pull to each area. So we have, if a pediatric comes in as part of the group of patients who are going to come in the department, we are prepared to deal with that. We've got the pediatric airway, we've got the adult airway box, we've got the hemorrhage box, and you'll see all the you'll see all the pads. Hang on, let me open one for you. So there are plasters, there are pads, there are the hip braces.
Yeah.
So these are all checked regularly and up to date. And that's the circulation box. That's where all the cannulas, the giving sets are. And these are the dressing box for when we do have burns presenting in the department, wounds, gaping wounds. That's that. And we also have a burns box. And each stock trolley is similar, and they're all ready to be pulled out to each area of the department. Talk you through the shelves here. This is where we keep all the folders that will be needed to register all the patients. This is the registration cards. And once there's 001 to 024, there are 24 ready registration cards in each folder. Once we've used them all up, we go for the next one. And usually there will be a receptionist who will be manning all the paperwork. And on this side will be extra bags. It's like a grab bag. And we have airway, breathing, circulation in there. And there will also be dressings for burns. If this is when we have run out of materials from this stock cupboard, we've got spares that we can just pull from this area as a surplus. And here is the Ramgenie, which we'll be discussing in a different video. This is the radiation machine that we use to see if patients have been exposed to radiation. Extra gloves are in there, extra masks, all sorts of masks, and these are caps, disposable caps, and they're colored according to what role people play during a major incident. So yellow ones are for clerks, blue ones are for nurses, red ones are for doctors, and white caps, disposable caps, for everyone else. And what else have we got here? And these are the gowns. Now, these are, you know what these are, but please don't take them from the major incident cupboard if you're in need of one. They need to stay here for the major incident purpose alone. We've got suction machines in here, flexi slides, and this is where we keep all the batteries for all the training suits that we charge regularly. The training suits, the PRPS, which you're gonna be watching in a different Zoom video, they all have batteries. They are live, ready to be used. When you pull the box, there will be batteries there that you can just put in the suit and you're good to go. These batteries here are only for the training suits that we use during our training. Now, let me just show you this pack. Now, it's red, so it's dirty. And we keep all these packs in the blue container right across emergency department. That's where we keep the tent as well, and all the PRPS suits ready to be used, and the training ones. So I can take you there when we've got the time, so I can show you where everything is in that container. And in that container is where we keep these. Now, this is a pack that if a patient presents themselves covered in powder, what we do is open this pack, get these instructions on, because normally these patients will be in a panic and they wouldn't know what to do. So you need to get this instruction page and throw this pack to the patient, and they have to stay away from you as far as possible. Hence, the megaphone. This is what we use when giving instructions to the patients. If you speak as loud as I do, you probably don't need this anymore. But just so Your patient can understand what you're saying, giving them instructions on what to do. Everything is here for you to guide them step by step. So let's get closer. You have to tell them, number one is all numbered so it doesn't confuse anyone. They have to put the gloves on, and inside this box is a paper wipe, face wipes, and they have to wipe their face, blow their nose, and there are disposable bags inside here where they can throw the face wipes. And number 5, they have to put the dust mask on, and they have to cut their clothing off. Remove clothing down to underwear, not over the head, as they've already cleaned their face. It has to go down their feet. And this pack is provided with cuttings equipment there that they can cut their clothes off with. And it will be there, cut if required, if they can take them off down the legs. Now, dispose of clothes into a larger bag. These bags are all provided in there. And there's also a bag just for the valuables into a smaller bag. And this green, red thing is the cape, the Dignity cape that goes all the way down to their feet. So they're all covered now. They're wearing a mask, they're wearing gloves, and they're wearing a cape. And then it also comes with shoes and socks. And then there are disposable again, another disposable bag for underwears into a large bag. And then the gloves needs to be disposed again in the same bag. And then tag on clothing bag. It comes with a tag so they don't lose their properties. They keep it with them. And the valuable bags also has a tag in them. So that's all for this one. So when someone presents to you in the department covered, you tell them to stop, not to move any further. They will be in a panic. Throw this at them and make sure they listen to you when you give them the instructions step by step. So we probably need to practice on this. If you're not quite sure, you can come in the major incident cupboard, have a look, and then we can go where we keep the stock. So those red ones are kept outside because they're dirty, and these packs, so when they go inside the tent, we put the tent at the ambulance bay. They will be wearing the red cape, the red Dignity cape when they go in, and that's where, in the tent, that's where we clean them up, decontaminate them. That's when we take all those off, and when they come off, when they've been sterilized, washed, they go to the green area. This is what they wear, the green suits. It comes with another cape, shoes, socks, gowns, everything. So patients are not exposed in the department and they keep all their dignity. And that's it. That's a wrap.